pretty mixed crowd, so I've been asked to give some very quick background, but for the luckily uninitiated. But medical terminologies are static, manually curated, hierarchical lists of medical concepts. There are a lot of terminologies for different purposes. Probably the least dynamic thing you'll hear discussed at this conference, but they're really crucial to the functioning of modern distributed clinical care. Without ICD, your doctors don't get paid. Without RX norm, your morphine prescription becomes Thorazine, and without a terminology for your CPOE, your trip to phlebotomy gets you a lobotomy. So, however, to be useful, terminology concepts have to be accurately identified. And this is really a laborious process that currently is done by clinicians at the point of care within form entry interfaces for their EHR, or by professional coders done asynchronously. So to streamline this...
Are you able to hear in the back? Because he's not using the microphone. I just wanted to... Okay, can you...
Sorry.
You mind? Thanks.
Do I need to repeat anything?
You don't have time.
Okay. So to streamline this inefficient process, there's been a big push in informatics to develop natural language processing tools to automatically parse out terminology concepts from text. So this is a demonstration interface to the Clinithink parser, which we've developed in response to this challenge. So let's, for example, consider a note that contains the word asthma, intentionally misspelled, gets tagged to a SNOMED concept, which SNOMED is general purpose clinical terminology. Behind the scenes, we see a defined SNOMED code, which happens to be the child of a concept for disorder of the respiratory system. That concept gets mapped to ICD-9 and ICD-10 concepts to show that this patient was treated for asthma. Now, Wikipedia is not exactly the most well-regarded medical reference, but we use this to demonstrate that not only could we map this to a reference for asthma, but also related concepts, such as bronchial hyperreactivity, which is a very related concept. Now, let's turn this example around and consider not intentionally misspelled, but again misspelled, bronchial hyperactivity in a note. We see again that gets tagged to ICD-10s for asthma, and Wikipedia entry for asthma showing if somebody was doing research on asthmatics and they searched for asthma, this patient would come up even though it doesn't contain the word asthma. Now here's a sample outpatient note for a patient showing up with a headache. Contains an interesting phrase: mother has a severe allergy to penicillin, but she has no known penicillin allergy. So let's see how it does with that. Pasting that in here. This is running off a SaaS server in Germany, just for reference. See, presenting complaint of headache. Family history, indeed, is shown to have a penicillin allergy of the mother, while the patient herself has no penicillin allergy. So, while this is clearly transformative to billing or quality care reporting and decision support, there are also infinite other clinical challenges one could approach better with the sort of data that we're extracting. I'd love to be able to propose a formal developer challenge here, but we don't have the ability to do that given the complexities of doing experiments with clinical notes, obviously are restricted by HIPAA. But if you do want to do, or have any thoughts on doing any experiments with this, whether you work with real clinical notes or if you want to propose a PHI-free application of it, I'd love it if you'd drop us a note, ideas@clinithink.com, to start a conversation about it. Thanks.